Following is a sponsored segment.
Dr. Dilan Ellegala is working to change the face of spinal care with a revolutionary procedure. His use of ultrasonic technology prevents the need for spinal fusion to eliminate neck and back pain. He joins us now to tell us more about this procedure. And we were just talking a moment ago that this is quite the advancement, because what's been done in the past is something, spinal surgery has been the same since the 1940s. The way you would do it.
You know, in a lot of cases, the tools that we use to do the operations have been around since then.
Yeah.
And if you think about it, that doesn't really make sense. We don't drive the same cars we drove in 1940. We don't use the same telephones. But here I am operating on your spine using the same instruments we did in 1940 in a lot of cases.
Right. So let's talk about that. And for people that are watching right now that may suffer from back and neck pain, what change has taken place and how does this affect the patient?
So the biggest thing is we were looking for ways that we could decompress nerves, relieving pain, improving the patient's symptoms without creating so much instability in the spine that requires us to fuse them. So often we put screws and rods and fuse a patient's spine. This technology, ultrasonic technology, along with the technique, and that's the critical part, allows us to decompress the nerves without destabilizing the spine. So no fusions. It allows us to avoid spinal fusion.
What does that mean for recovery and the way somebody feels after?
Yeah, you know, once you have your spine fused, especially in the low back or the neck, it takes about 3 months for that bone to fuse. So you're not really able to participate in full normal activity for at least that length of time. Also, your spine is meant to bend and move. If you fuse a segment of your spine, it puts more stress on the levels above and below, and that can then start to give out. It's called adjacent segment disease. So if you can avoid a spinal fusion and retain the normal mobility of the spine, that's better. And this is what this allows you to do.
So Sonospine and Sonosculpt technique is what it's called. You've been doing this for quite some time. What do you hear from patients that have had this done?
You know, the first thing is it's outpatient surgery, so which is for many patients that's a wonderful experience, not having to stay overnight or 2 or 3 days in the hospital. They're up walking immediately after the procedure. And so what I hear from patients is, never thought this would be possible. I've got my life back.
Wow.
I'm not in pain anymore after often years. And it's often patients who've had prior spinal surgeries, prior spinal fusions, neck surgeries.
Yeah.
So we're seeing patients who have hope.
Yeah. There are probably people watching right now that maybe have put off surgery because of, I don't want to go through that. What patient would benefit from Sonospine?
Really, anybody who is having neck or back pain that's looking at a possible surgical option. This is a good thing to consider as another alternative to what we're doing with traditional techniques.
We have the website up on the screen right now, but if someone is watching and knows somebody that's maybe considering surgery right now, what would you say are the next steps to take?
Yeah, my advice to every single patient is get as much information as you can. Get first, second, third opinions. So the more information you have, the better. If this is something that a patient wants to consider, call our number, go to our website, and come see us in clinic. Our goal is not necessarily to operate on our patients, it's to get you better. So often that's providing non-surgical options, going over all the traditional surgical options as well as this. We want our patients to be informed enough to make the best decision they can for themselves.
What is it like for you to see these advancements in the technology?
Yeah, it's kind of what I live for. I want to make what we do better every single time. And so the technology advancements that are occurring in the engineering laboratories allows us to do what we do better.
Right. I know there are people watching right now, and I want to put the number back up on the screen. We just had it up there for a moment. 855-982-1591. I want people to write that down right now. If you know somebody that has been suffering from back and neck pain or is possibly about to go through those surgeries, make that phone call, at least get some more information. And this could be the procedure that does, like you said, I think that sticks with you, what the patient said, changed my life. I didn't think this would ever happen. Pretty incredible stuff. Thank you so much for sharing your information with us today.
Thanks for having me.
Great to meet you, and we're going to have more of Let's Talk Live coming up right after the break.
The proceeding